Okay, guys, so this will be your discussion of CBOT 5 medicine papers. So, without wasting time, let's get started. So, 35-year-old patient, first hint is always age, experiences pain that is radiating to his shoulder, accompanied by dyspnea and sweating. So, maybe they are telling you about chest pain, which could be an angina or MI. So, that is the meaning of entire this line. Patient is known case of CKD. So, you have two things: CKD patient with chest pain, diaphoresis, sweating. So, it could be two things in my brain now. It could be unstable angina, or it could be MI, or third thing it could be uremic pericarditis. So मेरे पास तीन differential आ गए, क्या क्या? MI, angina, uremic pericarditis. Let's see. Following statement is correct. Above is a case of MI. Yes. So they're asking you इनमें से correct क्या है? So this could be a true statement. This is true. CKMB is far less sensitive and specific than troponin. ये सबको पता है. That is a true statement. Troponin is much better. तो ये भी true है. Moving to third one, rise in cardiac troponin level over 10 hours is needed for diagnosis. So, to make a diagnosis, we will see rise in cardiac troponin over 2 to 6 hours, not 10 hours. So, this is a wrong statement. So, these two are correct statement. This is a wrong statement. अब देखो इस टाइप के क्वेश्चन क्यों डाले, बिकॉज नाउ इट इज एन एग्जाम, दे आर आस्किंग यू दिस टाइप ऑफ क्वेश्चन, ओनली 1, 1, 2, 3, 1 to 4. So that's why like we have added this type of question. So you can see first two statement A and B are correct, and third is correct. So remember, for MI to be positive, cardiac troponins we measure like rise will be seen after 2 to 6 hours, not over 10 hours. So answer will be A and B. So answer क्या होगा इसका? 3. Simple. And I told you like DDs in this case. So it could be unstable angina, first possibility. Second, it is MI, like so they are telling you more information of MI. Third possibility in this case will be uremic pericarditis, because uremic pericarditis can also present with I can say sometime ST elevation, and even like in CKD patient, many CKD patient they have a false positive troponin and CPKMB. So that is again, so these are the differential diagnosis in my case. आगे चलते. A 28-year-old woman, so young female, visit the doctor because she has difficulty sleeping at night. Insomnia हो रहा है. She feels crawling on her legs, which get relieved when she move her legs. So this is the hint. She is having a feeling of crawling, and that is improved when she move. So this is a classical, means I can say symptoms are improved on moving. That is a classical case of restless leg syndrome. So they have mentioned how many statements are correct. So it is a case of restless leg syndrome. So here you will see like patient will have like abnormal I can say sensation or abnormal feeling in the legs, and when she will move there will be improvement. So this restless leg syndrome, remember it is a case, so this is a true statement. So ये भी correct है. So it's a true statement. It is autosomal recessive. No, it is autosomal dominant in nature. So this is a wrong statement. It is autosomal dominant in nature. Do we give pramipexole? Again, it's a true statement. So in treatment of restless leg syndrome, we give pramipexole and we use ropinirole. Can it be associated with low serum ferritin? Means is it seen in patient with anemia, in deficiency anemia? Answer is yes. So it can be seen. So again, there are a multi-factorial reason, multiple causes for this condition. So it is not due to single one reason. There is an aggregation of multiple factors. So iron deficiency anemia could be one of the factors. So A, C, D, these three are correct statements. So let us see the option. So answer for this question will be A, C, D. So I don't see the option here. So remember, it is like I can say A, C, D means 3 are correct. They are asking you how many statements are correct. So answer will be 3. 3 are correct. अगले पे चलते हैं. Okay, you can notice a patient came to hospital. A test shown below was performed as a part of examination. So I think this is one of the easy. अब ये easy question मैंने क्यों डाला? Because it's a repeat question. So this is a repeat topic. INI-CET they are asking again and again. Even in NEET PG also they have asked. So simple, it is Babinski sign. So what you will notice in Babinski sign, you will notice like there is dorsiflexion of thumb, of toe, and there will be fanning of fingers. in a normal people, what you will see plantar fraction. So this is Babinski sign positive. It is a feature of upper motor neuron lesion. Ankle jerk, you will get an image of ankle. So maybe here when we tap on with the knee hammer. Sometimes, so ankle jerk, whenever we suspect any pathology related to S1. So ankle jerk means that's simple. They will tap one ankle, then you can see the movement. Now coming to a Jandrasic maneuver, it is a maneuver. So sometime like when we do the knee test on a same patient again and again, what happens? There is adaptation. So adaptation means then you cannot see knee jerk or ankle jerk or supinator, pronator or biceps jerk. So in that case, what we tell the patient to close both arms and do like this. This is something. When a patient will do like this is what we call this Jandrasic maneuver. So this is again not in the image. It is not a normal response. So this is a classical case of Babinski sign. Simple. This is, you can see how to perform ankle jerk, or we also call this Achilles jerk. Then if you notice like this, I told you this is Jandrasic maneuver. Moving to next one, this is something where I know many of you made a mistake. So mononeuritis multiplexa. Now mononeuritis multiplexa, it is something which we can see in many vasculitis, right? So we have studied this in giant cell arteritis. So understand this, but they are telling you not only this, they are telling you mononeuritis multiplexa, skin lesion and neutrophilia. These three things together. So just try to understand this question. Churg-Strauss syndrome will have mononeuritis multiplexa, right? So I am writing in short mononeuritis, मैं mono लिख दे रहा हूँ. Plus you will see skin lesion here. That is true. But इसके साथ में क्या मिलेगा? What else you will see here? You will see here patient will develop eosinophilia, not neutrophilia. So ये छोटा सा silly mistake जो आपने करी है, don't worry. So यहाँ पर करिए, you will not do this mistake in exam. Now coming to giant cell arteritis. Here you can see mononeuritis multiplexa plus headache. There may be slight increase in neutrophil count, but you will not see skin lesion. Skin lesions are unlikely. Cryoglobinic vasculitis is a rare form of vasculitis, so which is mostly associated with hepatitis C and sometimes with hepatitis B. So again here you will not see this. So understand this thing. Giant cell arteritis and Churg-Strauss में मिल सकता है, but giant cell में क्या होगा? Headache होगा. Skin lesions are unlikely. So PAN is the only condition where you can see the classical three things. Means you can see mononeuritis multiplexa, you can see skin lesion, and you can also see neutrophilia. Is it clear? So closest differential. देखो इसका आंसर why it is not Churg-Strauss syndrome, because Churg-Strauss syndrome में eosinophilia होगा, and why it is not giant cell arteritis, वहाँ पर generally skin lesion नहीं होगा. Simple. So answer will be B. Okay, moving to next one. A 30-year-old male visit OPD. 30-year-old with complaint of numbness in forearm. Forearm पे numbness है. It means कोई ना कोई neuropathy, some sort of neuropathy during the night. A patient has following visible features. So you can see like a prominent jaw. So a classical finding, you can see it's a case of acromegaly. So acromegaly आपको दिख रहा है, तो acromegaly का patient है. What is correct about diagnosis? So I can tell you like it's a patient with acromegaly who is coming to you with some neuropathy. So कुछ ना कुछ neuropathy हो रही है. So what is a common neuropathy which we can see? We can see like patient can develop. Yes, very good. Carpal tunnel syndrome. So acromegaly के patient में क्या होती है हमेशा? There is risk of carpal tunnel syndrome. So actually they are asking you an anatomy question. Carpal tunnel syndrome कौन सी nerve से होगा? So ulnar nerve entrapment will cause cubital tunnel syndrome. There is radial nerve entrapment, no. So in here you will see median nerve. So carpal tunnel will involve median nerve. There is no musculocutaneous nerve. So answer will be C. Simple. तुक्का मारा तो भी सही. Again, just remember the logic. In acromegaly, in late stage only you will see patient will have neuropathy. That is, there can be risk of carpal tunnel syndrome. Now coming to a patient was diagnosed with Whipple disease. How many statements are correct? So let us see disease of middle age and elderly. So remember, suppose you don't know this, so let me keep it. So Whipple disease, we are studying in medicine, so of course you will not see this in pediatrics. So again, it is a disease of middle age and elderly. So this becomes a true statement. Correct. Is it autoimmune? No, it is an infection. It is due to Trophirema whippeli. So Trophirema whippeli से होता है, which is a bacteria in actinomycetes group में आता है. So that is not an autoimmune. This is an absolute false statement. It involves GIT, Whipple disease patient. So remember, Whipple disease patient will have weight loss. Patient को और क्या होगा? There will be hyperpigmentation. Then you can notice there is infection, and infection with Trophirema whippeli. Then patient can develop polyarthritis. Polyarthritis. So इसका मतलब this statement is also correct. This is true statement. Then a patient you will see like PAS positive macrophage in lamina propria. Then patient can develop loose stool. There will be enteritis, and patient can develop steatorrhea. And two more things I will add here, like with enteritis there can be encephalitis like feature. So just I can say encephalitis like feature. So we call this neurovipples. And there can be culture negative endocarditis. Culture negative endocarditis. So these all features of Whipples you can remember by mnemonic Whipples. Whipples. So देखो CNS involve हो रहा है, GIT हो रही है, joint हो, so this is a true statement. Proximal and distal small intestines involvement. Yes, it can involve both proximal. Proximal is more involved, so this is again a true statement. So क्या गलत है? This is a wrong statement. So A is correct, C is correct, D is correct. So answer will be A, C, D. They are asking you how many are correct. So कितने correct है? 3 correct है. So answer will be 3. Simple. Whipple disease. आगे चलते. Okay, they are asking you about GCS, glass glaucoma scale पूछ लिया, कैसे याद करना है. So just remember in GCS you can remember by a mnemonic. So glass glaucoma scale को कैसे याद करना है? So we have 3 component. We have eye component, we have a verbal component, and we have motor component, right? Eye, verbal, motor. If I talk about eye, so maximum score is 4, verbal 5, motor 6. So 4, 5, 6. So if you see the net, अगर आप total देखोगे, so maximum will be 6 plus 5, 11, 11, 4, 15. And minimum score we give is 1 to each. So minimum एक भी होगा तो कितना होगा? 3. Minimum will be 3. The problem is every time we teach student, they make mistake in GCS. So let me make it very simple. ESPN. ESPN, sports channel. E means eye opening. खोल रहा है आँख. S means only opening due to sound. P means opening because of pain and no response, not opening. Then we give 1. So अब इसको descending order में लिखना है. So score how we will write? We will write score like this: 4, 3, 2, 1. Simple. Eye opening automatically, spontaneously. ESPN, sounds means चिल्लाने पर खोल रहा है आँखें 3. To pain, 2, not opening 1. Now coming to a verbal component, we can remember. How we can remember? Again here maximum will be 5. तो कैसे याद करना है? We can remember this like oriented to time, place, person. Confused. So oriented means 5. Confused means 4. If he is using inappropriate word inappropriate, so मैं सिर्फ W लिख रहा हूँ. Then incomprehensible sound means he is just moaning and no response. So remember the mnemonic R, country, win. R means oriented, country means confused, W means word inappropriate, I means incomprehensible sound, and not opening means कुछ नहीं कर रहा. So how we will label this? 3, 2, 1. Now coming to motor component, so here we have 6 cores. So इसको कैसे याद करोगे? Remember the mnemonic can't live without fan. Can't live without fan. Can't live without fan का मतलब क्या होगा? Understand this thing? Can't means he is obeying command. C for can't, C for command. Command obey कर रहा है 6. Right? Then if he is I can say localizing to pain 5. If he is showing I can say a withdrawal response to pain 4. If he is having a flexed or a decorticate type of attitude, abnormal extension, decerebrate like this posture, and no response 1. Now simple देखो आपको क्या करना है. ESPN, R country win. R country means oriented, confused, word inappropriate, incomprehensible sound, no response. Can't live without fan means command obey, localize to pain, withdraw to pain, flexion abnormality that is decorticate posture, abnormal extension that is decerebrate posture, no response. अब देखते हैं localize to pain. तो localize to pain कितना आ रहा है? 5. Withdrawal is coming how much? 4. Command obey how much? 6. And no response 1. So थोड़ी सी यहाँ नंबरिंग सही करनी है आपको. This is 1, this is 2, this is 3 and this is 4. और अगर इसको सही करेंगे तो यहाँ पर होगा ये this is A, this is B, this is C and this will be D. तो अब क्या आंसर होगा? फर्स्ट विल बी B. 1 का B तो एक ही में दिया है. 1B, 2A, 3D and 4C. So answer will be B. Simple. तो ये आपको याद रखना. GCS is always important. Like in past 10 years, GCS is always an important topic in NEET PG, be it FMG or INI-CET exam. हर जगह क्वेश्चन आता है इसका. Moving to next one. Condition which have raised D dimer level include. So D dimer level you can see in many conditions. Can it increase in MI? Yes. So it can increase in MI. Can it increase in pneumonia? Yes. Pre-operative state D dimer levels are unlikely increased. अगर बड़े होते हैं तो आप ऑपरेशन नहीं करते हो. So mostly you will see they are increased in post-operative, not pre-operative. Post-operative में बढ़ते हैं, so एक option गलत है. First trimester of pregnancy, no. So they are generally elevated in second and third trimester, not in first. Second, third trimester. So answer will be 1, 2. 1 and 2. Other than this, you can see in many cancers, sometimes due to side effect of certain drugs, in sepsis also D dimers can be increased. So यहाँ पर answer क्या होगा? 1 and 2. Clear? Okay, moving to next one. Immune mediated platelet destruction is seen in all except. Now try to understand. Drug induced thrombocytopenia. Suppose if there is any drug induced allergy, so drug can cause allergy or it can produce a idiosyncratic reaction, it can cause allergy or it can trigger the antibody. So यहाँ पर तो antibody बन सकती है, so it can be immune mediated, it can be, except पूछ रहा है. Infection can there can be antigen antibody response. So again, so here you can also see antibody formation. So infection can also cause immune mediated destruction. ITP in ITP there is actually antibody. This antibody will be directing against GP2B3B, GP2B3A. So ITP में basically होता क्या है? Like previously we were using the term idiopathic. अब इसको बोलते हैं immune. So here you will see antibody against GP2B3A. Now coming to Bernard-Solier syndrome, this is not immune mediated disease. Here actually what we see, you will see there is absence of absence of I can say GP1B. So absence GP1B, we call this Bernard Solier. So basically here platelet adhesion will be defected and you will see ristocertin test will be abnormal. Now agar I can say if you see GP2B3A is absent, if you see GP1B is absent, Bernard Solier. GP2B3A is absent, we call this Glanzmann thrombosthenia. अब इसको याद कैसे करना है, सिंपल है, B कम्स फर्स्ट, 1 कम्स फर्स्ट, पहले B आता है अल्फाबेट में, 1 आता है, ऐसे बाद में G आता है, बाद में 2 आता है, सिंपल. So remember Bernard Solier and Glanzmann, these are like genetic congenital absence of these GP1B and 2B3. इसमें antibodies नहीं होते. So answer will be C. Following is a list of statements regarding Wilson disease. How many are correct? So in Wilson disease, what happened? There is a deficiency of ceruloplasmin. Ceruloplasmin कम होता है. This is correct. Ceruloplasmin कम होता है, तो copper transport is basically affected. So copper will go somewhere. Copper will be accumulating in different tissues. So tissue में copper बढ़ता है. This is correct. And copper is going into urine. So this is also correct. But remember, when this copper is going somewhere, it is going into some tissues. It is going into I can say urine. Some tissues, like it is going into brain, it's going into your liver, it's going into sometime nails, sometime your skin, sometime heart. Predominantly, mainly this will go to 3 places, like it will go into your liver, it will go into your eyes, you can see a KF ring, or you can see sunflower cataract, or sometimes it can go into brain, so patient can develop dystonia and sometimes secondary Parkinson-like feature. So copper, when it is going somewhere, in serum it will be normal. So serum में ये बड़ा नहीं होगा. This is not a correct statement. So they are asking you how many are correct. So again here 3 are correct. So remember, serum copper is normal, or sometimes it is decreased. So that's why for screening we have 2 options to screen this condition. Either we can check for 24 hours urinary copper. ये बढ़ा हुआ मिलेगा आपको, this will increase, or we can check for serum ceruloplasmin. And what Harrison says, if values of ceruloplasmin are less than 15, that is I can suggestive of Wilson. Less than 5, that is confirmatory. So ceruloplasmin will be less. But remember, gold standard test to confirm, or I can say investigation of choice, will be a liver biopsy and quantitative copper estimation. So this will be liver biopsy plus quantitative. आपको लीवर के अंदर देखना है कितना कॉपर है, क्वांटिटेटिव कॉपर. So here answer is 3. Okay, physician show you a case in OPD. OPD में आपको केस दिखाया. Where a 30-year-old male patient complained of painful swelling on his hand since 3 months. 3 महीने से हाथ में सूजन आ रही. Positive rheumatoid factor, anti-CCP antibody. So okay, so diagnosis simple. It's a case of rheumatoid arthritis. So ये तो easy question हो गया. What drug you will use? Supportive therapy दोगे इसमें? No. Rheumatoid arthritis. So treatment of choice. Now what we do? We start straight away with DMARD. आपको DMARD देने. Penicillin नहीं दोगे. Penicillin, right? It is an antibiotic. Febuxostat you will use in a patient who is having chronic gout. ये तो chronic gout में देते हो आप, right? So even like now DMARD of choice, the drug that we start is methotrexate. So आपको methotrexate देना है. So there are different physicians. So starting dose generally we start with 7.5 mg tablet once in a week. हफ्ते में एक बार देनी होती है. If it is not controlled, like we can give 10 mg or 15 mg once in a week. But remember, methotrexate sometimes can cause toxicity. So उसके साथ में आपको folic acid भी देना होता है. And if toxicity develop, in that case we give folinic acid or leucovorin. So to prevent toxicity, folic acid. In treatment of toxicity, what we give folinic acid, we call this leucovorin or cetrovorin. So आंसर क्या होगा यहाँ पे? सिंपल है, बी. All are following are infectious cause of relative bradycardia. So relative bradycardia you can see in many patients who develop fever. So again salmonella typhi में होगा, yes, it's an infection. So typhoid में तो होते ही. Malaria can cause, yes. Legionella pneumophila, yes. So a factitious fever is like you are acting like you have fever, or I can say self-induced fever. तो बचपन में होता था कि कई बच्चे हाथ पे ना नींबू लगाते थे, तो फिर टीचर ने डंडा मारा तो हाथ सूज गया, जल्दी सूज जाता था, फिर टीचर देखता था इसके तो अभी से सूज के और नहीं मारना चाहिए इसको. ऐसी फैक्टिव फीवर मीन्स बुखार चढ़ाना खुद को. So that is a self-induced fever or malingering type of fever, which can be a sign of some psychiatrical condition, or sometimes there will be some job benefit in this. So factitious fever is self-induced, acting to have fever. So there is no bradycardia in that case. Simple. So easy question है. अगला देखते हैं. विद्या, a 13-year-old girl comes to OPD with her mother. 13 साल की बच्ची है, मम्मी के साथ आई. After recording the history, it was found she had been on anti-epileptic for about 8 months. So 8 months she is taking anti-epileptic drugs. She has not experienced seizure during this tenure. अभी सीजर नहीं आया 8 महीने से. Her EEG stand normal of late. EEG normal हो गया. Mother is also known case of epilepsy. So it means it is some form of hereditary epilepsy. So if I assume like when you can see genetic history, in that case my brain is telling me it could be, you can see the age, 13 साल की बच्ची है, means puberty age hit करिए, so it could be a case of myoclonic epilepsy which have some hereditary component. इसको हम बोलते हैं juvenile myoclonic epilepsy. So it could be this. Again I'm not confirming this without doing the changes, without seeing the changes in EEG. The doctor advised her to continue the treatment for another 16 months. Why do you think doctor advised so? Like I told you in the class, so we give anti-epileptic drugs, right, unless for a period, for a seizure free period of 2 years. अगर 2 साल से कोई दौरा नहीं पड़ा है तब तक आपको देना है. और यहाँ पर जहाँ पर भी जेनेटिक रिस्क फैक्टर है, मीन्स हेरिडिटरी कंपोनेंट है, यू कैन सी मदर इज ऑल्सो हैविंग, इन दैट केस समटाइम यू हैव टू गिव इट लाइफ लॉन्ग. तो लेट्स सी ऑप्शन. ये आपसे पूछ रहा है कि अगले 16 महीने और क्यों चलाना है. व्हाई वी हैव टू गिव? बिकॉज देयर आर हाई चांस ऑफ रिकरेंस. ट्रू, वेरी ट्रू. It is a genetic form of epilepsy, so there are high chances. They're asking you true statement again, because the drug can be withdrawn only when there is seizure period of about 3 years. No, this is false. This is false statement. यहाँ पर 2 year होना चाहिए. Drug can be withdrawn after a seizure free period of 2 year. Again, this is correct. आप बंद कर सकते हो अगर पेशेंट को पिछले 2 साल में कोई सीजर नहीं आया. मोस्ट ऑफ द पेशेंट ट्रीटमेंट हैज टू बी गिवन लाइफ लॉन्ग. यस, आई टोल्ड यू, लाइक जब जेनेटिक हिस्ट्री है तो आपको बार बार दवाई कई बार लाइफ लॉन्ग देनी पड़ती है. सो दिस इज अगेन अ ट्रू स्टेटमेंट. सो 1, 3, 4 दीज आर करेक्ट. 2 इज नॉट करेक्ट. सो आंसर क्या होगा? 1, 3, 4 बी. अगले पे चलते हैं. फॉलोइंग इज नॉट अ साइड इफेक्ट ऑफ ग्रोथ हार्मोन बीइंग एडमिनिस्टर्ड टू पेशेंट फॉर शॉर्ट स्टैचर. अब नाउ व्हेन आई सी दिस क्वेश्चन, suppose if I don't know this question, मुझे सच में नहीं पता, I'm not knowing few things about growth hormone because we routinely don't use this in practice. So if you give growth hormone supplementation, so nowadays many bodybuilders are also taking growth hormone supplementation. So growth hormone देने के बाद क्या नहीं होगा? So growth hormone will have an analog action on your glucose. So growth hormone, देखो अब when I see this question, अगर क्वेश्चन में हाइपो हाइपर दोनों दिया है तो आंसर इन दोनों में से एक होगा. There should be one answer definitely, right? So when you give growth hormone, this will increase glucose, right? Even we do OGTT in acromegaly. तो आप growth hormone दोगे तो उससे hyperglycemia होगा, hypo तो नहीं होगा. So what is not side effect? Hypoglycemia. Hyperglycemia is seen, yes. Excess growth hormone can cause acromegaly, it can cause gynecomastia, and sometimes like it can cause tinnitus also. So hypoglycemia you will not see. So easy question था ये, बिल्कुल simple. Okay, 38-year-old male is found to be positive for HBs antigen. So hepatitis B surface antigen is positive, and HBe antigen is positive. So hepatitis B surface antigen is positive means virus entered. HBe antigen positive means virus is replicating. इसका मतलब ये infective disease है. So he was diagnosed with chronic hepatitis B. I should add a word, chronic infective hepatitis B. Viral load is 2 into 1, 2, 3, 4, 5, 10 to the power 5. And SGPT was found to be doubled. To understand this thing, just I am writing a flow chart here. Hepatitis B, if it is acute, which is seen in less than 5% patient, or it is chronic. So in acute, we give IV fluid. Chronic agar hai, so in chronic form, understand we need to see like how all patients don't need treatment. Treatment you will give only in those patients whose LFT, SGPT, SGOT, they are increased by more than 2-fold. तभी आप ट्रीटमेंट करोगे. So understand this, chronic, maybe this person who is coming to you early, or maybe a person coming to it in I can say CLD state, cirrhosis के साथ में आ रहा है. So chronic form, understand this. In chronic form, when you can see 2 into 10 to the power 4 in those patient who comes early means cirrhosis नहीं है. And those patient who develop cirrhosis which can be compensated or decompensated, लीवर काम करे या ना करे, पेशेंट को हालत खराब हो रखी है, पेट में लीवर में नोड्यूल्स हैं, पानी भरा हुआ है, in that case 2 into 10 to the power 3 means patient is coming to you late with cirrhosis. Early means without cirrhosis. तो अगर पेशेंट आपके पास इसके साथ में क्या चाहिए आपको, प्लस यू विल सी LFT will be doubled. So when we start treatment we start when LFT is increased by more than 2-fold, right? And you can see viral load 2 to 10 to the power 4 or more, and in early cases and late cases 2 to 10 to the power 3. In that case we start any one of the drug. We have tenofovir or we use entecavir. So entecavir is 0.5 mg, tenofovir we have 2 option available. Tenofovir like we can use 300 mg, and we also have like 25 mg of tenofovir, that is nowadays we preferred. So like alphamide करके आती है tenofovir alphamide, so that we can use. So lamivudine दोगे नहीं दोगे, pyrrolate interferon no. So what we recommend, tenofovir for more than 40 weeks, simple. So any one you have to, इन दोनों में से कोई एक देना है आपको. Coming to next one. 68-year-old patient who is suspected to be suffering from infective endocarditis, evaluate under Duke's criteria. Following is not included. Intracardiac oscillatory vegetation on 2D echo, this is the major criteria. ये तो है. Not पूछा आपसे. At least one culture positive for IgG titer more than 1:800 for a Coxiella, ये भी true है. This is also a true statement, so it is not the answer. So this is true. Partial dehiscence on 2D echo, ये भी echo finding होती है, ये भी true है. At least more than or equal to one positive culture for typical organism causing infective endocarditis, ये true है कि नहीं? At least 2 होने चाहिए, not 1. So it is a false statement. Clear? This is a false statement. ये तीनों आंसर करेक्ट है. समझ आए? So this is true, this is true, this is true. They are asking you. Following is not included. So क्या included नहीं है? This is not included. So answer for this question will be D. We need at least 2 positive cultures. So let us see this. You can see positive histological culture. Then you can see major criteria 2 positive culture. यहाँ पर 1 दिया था उसमें. Then you can see Coxiella की serology positive है. This was given. In echo you will see dehiscence, or you can see vegetation, abscess, or any knee regurgitation. So you can see यहाँ पर क्या दिया? You can see here, you can see dehiscence is given and vegetation is given. So answer will be D. 59-year-old a man present to medicine OPD with chief complaint of frequent episode of bone pain, high fever, fatigue. Order various lab tests which reveals calcium 12, calcium बढ़ा हुआ है, hemoglobin 8.4, anemia है. Serum electrophoresis report patient is given below. Following statements correct with respect to most probable diagnosis. So you can see hypercalcemia, renal involvement, anemia, and bone features. So CRAF features, these are features of multiple myeloma. Then you can see this is called child spire pattern. So अगर आप देखोगे first spike is of albumin, then second spike you can see in IgG area, gamma area means IgG area. This spike is called M spike. So M spike दिखी हुई है, classical case है multiple myeloma का. So they're asking you what is incorrect about multiple myeloma. So what is incorrect? Let's see. Flow cytometry of this patient can be positive for CD138 or 38. Yes, it's a plasma cell disorder. So flow cytometry 138 के लिए positive होगी, 90-20 के लिए negative होगी. Clonal plasma cells more than 10% can be used as one of the diagnostic criteria. Yes, clonal plasma cell 10% से ज़्यादा होने चाहिए. This is true. This is true. Primary amyloidosis is most common cause of renal failure in these patients. No. Most common cause of kidney failure in these patients is hypercalcemia. Amyloidosis नहीं होता. So this is a false statement. Beta macroglobulin levels are used to assess a median survival period. So in these patients, yes. So international prognostic index के हिसाब से we use this beta macroglobulin level. So ये भी क्या है? ये भी true statement. Now they are asking you statement is incorrect. So C is incorrect. So that will be the answer. Cause of renal failure will be hypercalcemia. So this was our discussion. I hope you enjoyed this. Thank you so much. Keep working hard. Bye bye.